right, so joining us from his home in the United States today is a distinguished doctor, urologist, and neurological researcher, Dr. Kambiz Tajkarimi. Dr. Tajkarimi, thanks for joining us today.
Thank you for having me today.
I'm wondering, Doctor, could you tell us a little bit about your background and about your work in the area of urology and urological research?
Yes, I am a urologist in Frederick, Maryland. I trained at the George Washington University in Washington, D.C. I work in general urology. However, my focus is prostate cancer treatment as well as sexual medicine. I am a member of the Sexual Society of North America and International Society for Sexual Medicine, and my research focuses mainly on treatment of erectile dysfunction, especially after prostate cancer treatments, as well as ejaculatory dysfunction in men with spinal cord injury.
I'm wondering if you can tell us, right around the world, literally millions of men, including men in their 30s and 40s now, are being diagnosed and treated for prostate cancer. Now, what's fairly well known is that most of these men who are treated, through radical prostatectomies and otherwise, most of these men are going to develop severe and chronic erectile dysfunction. Why is that?
Well, that's a very good question. As you're aware, erectile function is a nerve-generated event. There are two very important nerves that run right next to the prostate as they travel from the spinal cord to the penis. These nerves are responsible for initiating, activities within the penis during sexual excitation to provoke dilation or the blood vessels to open up and allow the penis to fill with blood. These nerves are so close to the prostate that any type of treatment, including surgery, radiation, or freezing, can damage these nerves. Now, our technique in the past 30 years has improved greatly, where we're now able to do the procedure in a much more careful way to identify the nerve structures as best as possible. But even with the best technique, we still have a problem with making the nerves to be fully functional after surgery. That's why a lot of men develop temporary or permanent erectile dysfunction after surgery or radiation.
I'm just wondering if you could explain in layman's terms what is required for an erection to take place, because from what I understand, it's not just simply a matter of blood just rushing into the organ. It's quite a complex reaction, isn't it?
Exactly. All the stars need to line up for a successful erection to occur. It's a hormonal, neurological, blood, every system needs to work perfectly well for erections to occur. Erection is a neurovascular event. That means that the nerves of our body, they excite a specific center in your spinal cord that receive information from the brain and from the penis. Let's say that a patient or person smells a very nice, sexual scent, or a touch of a woman, or any type of stimulation.
Something that leads to physical arousal, you're saying?
Exactly.
Sexual arousal.
Physical arousal leads to a cascade of neurological events, nerve events, that sends signals to the penis for the blood vessels to open up and allow the penis to enter. This is a very important part one of erection. The part two of erection is that the blood vessels, as they fill the penis, they should be prevented from leaving the penis. So the blood is trapped for several minutes after excitation and adequate blood filling. So the blood is trapped and rigidity occurs. And this is in many men who have developed erectile dysfunction, either there's a problem with filling or preventing the blood from leaving the penis. It could be vascular disease, diabetes, or venous dysfunction, where the as many men cannot obtain rigidity no matter how much Viagra or Cialis they take, because the blood fills and immediately leaves, so they cannot obtain rigidity.
So you've mentioned that it's a neurological, it's a nerve condition as well as a physiological or a condition where I should say the blood is filling up to the penis. If we link that back then to a prostatectomy, a radical prostatectomy, where is the disconnect there? Why isn't the equipment working?
Well, multiple studies in the past few decades at great centers in the U.S. and around the world have shown that after surgery, the nerves develop neuropraxia, which is a fancy word for them to go to sleep. And the penis requires these nerves to constantly stimulate nighttime erections. And if these nighttime erections do not occur, the penis is basically not receiving enough nutrients and is not able to receive adequate oxygenation at nights, which is part of our male physiology is to develop nighttime non-sexual erections. The penis is always in a hungry and in a hypoxic state, which is a word for lack of oxygen. So in men after prostatectomy, the first problem is lack of nerve function. But if there is no adequate oxygenation for several months, the penis muscles, the muscles of the blood vessels develop degeneration. They basically start, becoming dysfunctional, and they start not working well. And men subsequently developed venous dysfunction, which is even when the nerves come back, they still cannot get a good erection because they have a problem with blood not wanting to stay in the penis.
So I understand that they get problems in terms of scarring as well if you're not having erections and
Absolutely, absolutely. The scarring has been shown in animal studies and in several human studies that basically the penile tissues develop atrophy, or the smooth muscles die. And this is where the concept of penile rehabilitation comes into effect. And this is a controversial issue, whether, does penile rehab really do anything anyways? And in my opinion, it really does. By starting to stimulate and doing everything possible to allow nighttime filling of the penis and even daytime filling of the penis, you can prevent progressive deterioration of the muscles and the health of the penis itself.
I think there's a bit of confusion out there amongst men who they've gone and they've had prostatectomy surgery. Some have paid, very big dollars to have had robotic surgery, and they've come out of surgery and they say, well, we've had full nerve sparing. So, I understand that my nerves are fine. What isn't clear amongst a lot of these men is why there is nerve damage if the doctor or the urologist has claimed that the nerves themselves were spared. Can you just give us a little bit of information as to what's happened there?
Well, you're asking a secret among the urologists that I'm going to share with you. We really don't know how much nerve we're going to spare. I perform about 2 to 3 prostatectomies a week, and I do them robotically, and I used to do them open as well. It is not the robot or open, it's the technique of the surgeon. You can still have fantastic results with open surgeons. It's the experience of the surgeon. But return of sexual function depends on 3 factors: the age of the patient, the pre-surgery sexual function, and also how much nerve sparing the surgeon thinks that they did. If a male has a surgery at the age of 45, his return of sexual function is going to be different than someone who has it when he's 75. And obviously, if someone has excellent sexual function before surgery, most likely will have better return of function than someone who is already dependent on Viagra 100 milligrams for not a very strong erection. The nerve sparing is dependent on the lack of excessive pulling burning and stretching of the areas that we think the nerves are located. However, even with perfect technique, these nerves are going to go to sleep. So your listeners need to understand the following. If the surgeon says, I did bilateral nerve sparing, your erections are not going to come back for several months. You just have to accept it. It's like a cyclist or a runner who trips on the road and breaks his ankle is not going to start running again for several months. And that's exactly what's happening in prostatectomy. You're not going to have erection for several months. So just accept it and focus on several months from now, am I going to do everything that I can to get back to normal?
So a man that's undergone a radical prostatectomy, what are the options that he has as far as treating his condition?
Well, the options that have been advocated by several centers are not really fully supported by much of any data, unfortunately. The field of penile rehab is a lot of speculation versus real data. Very few randomized trials have shown benefit of one over the other. Now, the options that are available and are mostly advocated is, use of PDE5 inhibitors, which are the brand names like Cialis, Viagra, whether on demand or on a daily basis. The other options are use of injections, which is a drug that is injected into the penis to provoke vasodilation of the blood vessels. And the other one is vacuum-assisted devices, which have been shown to be helpful in preventing shrinkage of the penile length to create an erection and constriction by placing a band. These are the three main options that have been advocated. Recently, in the urological community, we're looking at the role of nerve stimulation itself, which is if it's a nerve injury, why not stimulate those nerves for them to regenerate and wake up earlier? And that's where the concept of penile vibratory stimulation lies. Interestingly, the nerves that are injured by surgery are not involved in the nerves that we are stimulating by the penile vibratory stimulation. The nerves are called pudendal nerve. And pudendal nerve is considered the king of pelvis. And these nerves are the sensation of the penis, and they also have role in contraction of the muscles that are responsible for rigidity of erection. These nerves can be stimulated on a regular basis to create stimulation of the nerves that are injured, and this is an indirect reflex activity that is part of our human physiology. So recently, we are looking at a very, very easy way of stimulating the nerves and allowing the nerves to wake up faster, and that's called the concept of penile vibratory therapy.
So, can you explain to me, in a man who's using penile vibratory stimulation therapy, how exactly does it work?
Well, think about it this way. Men, as soon as we're born, we realize that touching the penis is a very important part of our life. Whether it's hand stimulation or part of our sexual activity with our partners, where we do repetitive stimulation of the nerves. Repetitive stimulation means back and forth movement, whether it's with the hand or with the vaginal or oral or whatever we use.
So
Why is that?
we're using very polite phrases here. What we're talking about effectively is masturbation and oral sex and normal vaginal sex. That's what you're
Exactly,
talking about.
exactly. So what happens is these nerves, they are part of our evolution. If you look at how horses and dogs and other mammals have sex, they do repetitive back and forth movement. These nerves need to be stimulated for erection to occur and for your orgasm to occur. Penile vibratory therapy has been used for almost more than a century for treatment of orgasmic dysfunction and sexual dysfunction in women very successfully. And recently, in the past 3 decades, it's been successfully used for men with spinal cord injury who have absolutely no sensation of the penis whatsoever. But vibratory stimulation can actually provoke sexual reflexes that are located below the level of their lesion to activate erection, activate orgasm, activate other unforeseen, things that happen, like relaxation of their legs and increased bladder capacity and many other benefits that are completely physiological.
That's
Now,
quite remarkable what you just said. That men with spinal cord injury are able to use penile vibratory stimulation. Given that most of us expect that, there's, as you said, there's no sensation. That's quite an astonishing fact.
Absolutely. The neurophysiology of erection is still a very untapped territory, Patrick. There are many, many studies that are coming out of many amazing centers of excellence talking about how the dorsal nerve of the penis, which is a simple nerve that is so amazingly connected to centers of our brain and spinal cord that have to do with almost everything, whether it's emotion, whether it's hormone production, whether it's testosterone production, love hormone production. These nerves directly stimulate those centers. There was a very interesting study that men who have severe PTSD, which is post-traumatic stress disorder, and depression, erectile dysfunction, have a very hyperactive part of their brainstem called the cerebral cortex, which is the amygdala. And the studies have shown that by stimulating the penis of study subjects, you actually can shut down these depression and anxiety and PTSD centers by just stimulating the penis. We don't know much about neurophysiology of the penis, but what we know is that it's incredibly amazing.
I have to say, when I read these studies, I'm absolutely gobsmacked at how little we actually know and how much we're discovering almost on a daily basis. I'm just wondering if I could take you back just a little bit. When we were talking about how penile vibratory stimulation or PVI works, we also earlier in this interview, we were talking about the role of the neural transmissions, the arousal, what's going through the brain, the spinal cord, and the reaction that takes place in the penis. How, from a perspective of PVI, how does this, PVS, I should say, how does this all connect together? The brain, the spinal cord, all that sort of thing.
Perfect. One of the most important neurotransmitters for erectile function is called nitric oxide, which is what is a neurotransmitter is signals coming from your central nervous system. Neurotransmitters increase activity of our tissues, whether it's muscle contraction during walking, or whether it's crying or sweating. These are neurotransmitters that secrete, that allow our body's organs to function. In the penis, nitric oxide is one of the most important neurotransmitters that has been shown to play a major role for erectile function. Now, like for example, these medications that we are very well aware of, like Viagra, Cialis, Levitra, they keep nitric oxide longer in the penis nerves to allow the blood vessels to continue to remain open. Now, we all know that multiple studies have shown that penile vibratory stimulation actually increases nitric oxide activity in the penis. So it's like almost taking Viagra by allowing more nitric oxide to be in the penis. Viagra, on the other hand, cannot do a thing if there is no nitric oxide in the penis. So if there is no stimulation, and we all know this, if you just take Viagra and sit there and watch, CNN or, news, nothing is going to happen. That vibratory stimulation increases nitric oxide activity through reflexes. And we all know this. When we are touching the penis during masturbation, we notice there is increased girth of the penis and eventual erection. Now, this problem is different in men with ED. You need to have a lot of stimulation, and you probably cannot reach that level of stimulation with the hand. I see many patients, Patrick, and I'm sure you do as well, who come in and say, "Doc, I had prostatectomy a year ago with really intense hand stimulation. I can really get a decent erection, but I get tired and I can't reach the level of rigidity that I want." And that's
They also do themselves damage trying to do that as well.
Exactly.
Like in some cases,
I mean,
they get micro tears in the penile shafts, and they get a lot of soreness.
Exactly, because they are being a little bit difficult for hand. Now, the concept of penile vibratory stimulation is to stimulate specific mechanoreceptors, which is basically the antennas that are located on the surface of the penis. These mechanoreceptors are rapidly firing, and what they need is a very high frequency and amplitude stimulation, which the two major vibrators that are now in the market that can reach that level of stimulation to basically easily stimulate these centers. And the two devices that are approved for medical use are the Vibrect and the Ferticare. The Ferticare is a device that is approved for provoking ejaculation in men with spinal cord injury. The Vibrect has two versions. One is approved by the US FDA, Health Canada, European Union, and Australia for provoking penile erection in men with ED. Now, that could include prostatectomy patients. It could be anybody with erectile dysfunction. And we also have another version which is called the Vibrect X3, which is stronger for adequate stimulation for ejaculating men with spinal cord injury.
So in a man who's using vibration stimulation, why would they use vibration stimulation as opposed to just the normal treatments like Viagra, Cialis, or even injections? If they've undergone a prostatectomy, what's the difference going to be by using a device like a Vibrect for vibratory stimulation as opposed to staying on the more traditional treatments that, the majority of
Well,
urologists know of, but, they haven't extended their knowledge to include PVS?
well, in studies that have been done, PDE5 inhibitors have not really shown to enhance recovery of spontaneous erections. Remember what we're talking about is, how are we going to help a person after prostate surgery to hopefully in a period of time return to a spontaneous natural erection not dependent on Viagra or other medications? Number one. Number two, what does Viagra has shown? We have to look at evidence. Viagra and Cialis have shown that they help with preserving smooth muscles in the penis. They do not at all show any evidence of whether they increase nerve regeneration and functional recovery of nerves. And that's something that Viagra does. Vibrect does. Vibrect stimulates the nerves. Of all the treatments that are available for post-prostatectomy, Vibrect is the only treatment that addresses nerve dysfunction, which is what the original problem is, by stimulating the nerves. Now, if a person masturbates 2 to 3 times a day, they can still benefit. But I believe with a more focused stimulation, it's much easier and much better and more focused.
So, based on what you've said about nerve regeneration, and we've talked about the damage to nerves and the erectile problems, how soon should a man start using vibratory stimulation? Should he think about using it before his surgery, after his surgery? How soon? Ideally, what should be the time frame, and realistically, when should a man start using it?
Ideally, in my opinion and opinion of many sexual experts who use vibratory stimulation, is to start it 2 to 3 weeks before the surgery is done. Why? The reason is they need to experience the stimulation of the penis by the vibratory therapy before the nerves are injured, so they can mentally return to that state and expectation of what can happen, the cascade of events that occur during the stimulation. Number two, right after surgery, men develop some elements of urinary incontinence, and they are more worried about return of urinary control and dryness than anything else. So they kind of put the erectile rehabilitation on the back burner. In my opinion, start early, start before surgery, and empty your bladder and do vibratory stimulation absolutely every day, or at least 4 times a week in a sexual setting. So start as soon as possible.
So, two questions I have for you. When you say as soon as possible, are you talking about as soon as the catheter is removed?
Exactly. As soon as the catheter is removed, and maybe a couple of days to make sure that you don't have any urinary tract infection or burning, then begin the therapy. The therapy is extremely painless. It's actually very pleasurable, and it actually produces very strong orgasms. So it has a positive reinforcement. And if you ask patients who use vibratory therapy as soon as possible, they even tell you they get 30, 40, sometimes 50% fullness and erections right away. Not rigidity yet, but the head of the penis and the rest of the shaft really engorges with blood. And in my opinion, I think this is very beneficial with oxygenating the penis, as we discussed.
You also mentioned the phrase in a sexual setting. What did you mean by that?
Well, the sexual setting is, I would say in a reenactment of mental thoughts perhaps with a partner, or watching visual stimulation, such as pornographic material. I always tell my patients right after surgery to do not become distant with their partner. Be close, be sexual, be kinky, whatever is possible. Studies after studies have shown that sexual stimulation after surgery by patient's partner, a motivated partner, enhances recovery of erections. And I tell them, the first thing I tell the patient is to buy a vibrator or a dildo for his wife and make love to each other without sexual intercourse. Make love to her, whether with hands or with a vibrator, and be close. Let her stimulate you, and be close at least 2 to 3 times a week.
I've got a question here in terms of at what stage is it too late to use vibratory stimulation? If you're a man who's listening to this right now, or someone who cares for a man who's undergone a prostatectomy, but perhaps maybe 2 years ago or longer, 5 years ago, is it too late for those men?
We have had, we received testimonials from men who have had surgery even in the late 1990s, and they have had moderate to severe erectile dysfunction, and they use the Vibrect religiously, and they notice the improvement in their rigidity and erections. I believe it's never late to use nerve stimulation. Remember, Patrick, erectile function is a complex activity, and multiple studies have shown that the nerves that are injured after surgery are not the only nerves that are absolutely responsible for erection. There are nerves that are not even in the field around the prostate that are still very contributive to our erectile function, such as the pudendal nerve that I told you. So men who have had surgery several years ago and maybe the nerve was completely destroyed or they had the nerves removed, they can still somewhat benefit. Now, with understanding and expectation that it's probably going to be less successful than someone starting it as soon as possible, but still they can benefit.
In what way will they benefit?
They can benefit with potentially strengthening the muscles like a workout that are really deep in the pelvis, that are responsible for rigidity of erection and preventing the blood from leaving the penis. As I mentioned to you, Patrick, many men after prostatectomy, they eventually develop venous dysfunction where the blood doesn't want to stay in the penis, and that's why they cannot get rigid and firm. And men who use vibratory stimulation or very strong Kegel exercises, the stretch exercises that are recommended by doctors, they can strengthen these nerves and perhaps improve venous dysfunction. Another problem that post-prostatectomy patients develop is orgasmic dysfunction, poor orgasms, low intensity orgasms, and painful orgasms. And these three things, I believe, can be helped with vibratory stimulation.
So even in men that had their surgery, as you said, in the late 90s, have they been able to reach orgasm using vibratory stimulation?
Yes, most men using Vibrect develop excellent orgasms, and that's one of the benefits of a high frequency and amplitude device, is that you stimulate enough to reach orgasm. Regular vibrators that are used for shoulder and female vibrators don't produce enough frequency and amplitude to provoke ejaculation and orgasm.
What about men that have undergone alternate treatments such as brachytherapy, seed therapy, or even hormone therapy, what's commonly called androgen deprivation? Can vibratory stimulation help these people?
I believe that any of the treatments that you mentioned still develop nerve dysfunction and injury to the nerves, whether it's a slow process or a fast process. We are not intensely studying patients after radiation to use vibratory therapy, but many patients purchase it after radiation and they use it. I do not see any contraindication for using it, but remember, post-radiation erectile dysfunction is a combination of damage to the vessels and damage to the nerves. And it's a progressive problem that may not begin right away and could lead eventually to permanent dysfunction. I would say to your audience that if a person has severe, complete erectile dysfunction and that lasts at least 2 years after radiation, they probably will need to use more invasive therapies like penile injections and penile prosthesis.
I'm regularly asked about more commonly prescribed methods of treatment, namely the medications we talked about, the PDE5s, which include Viagra, Levitra, and Cialis. Now, it's fairly common for men who have undergone a prostatectomy to be prescribed 5 milligrams of Cialis, for example, these low dosage or low strength PDE5s for daily use. My question is, are these men wasting their time with these medications at these low strengths? And when I ask this question, I'm asking, what's the evidence to support daily usage of low strength PDE5s?
Very interesting question. Recent data presented at the American Urological Association in May of 2013 showed that there is no evidence of daily use benefit versus on-demand use. The on-demand use is taking a higher dose of the Viagra or Cialis and attempting sexual intercourse versus taking it daily. I believe a frequent use of Viagra or Cialis is beneficial for preserving the smooth muscles. And in my practice, I recommend taking 100 milligrams of Viagra before vibratory stimulation at least twice a week, or at least 4 times a month. Whether it depends what they're seeking. Are they seeking that taking the 5 milligrams of Cialis or daily Cialis, are they expecting to have an erection adequate for sexual intercourse, after prostatectomy in the first few months? I don't think that's a good expectation.
I think that the majority of men that are taking the low strength, as I said, like the 5 milligrams of Cialis, and I'm not just pointing the finger at Cialis, Viagra and Levitra, the same thing. They're prescribed these tablets that they take on a daily basis, and I think
there's no data supporting what is the expected outcome. Is it a spontaneous erection?
I think they're just following instruction, and that they're told that if they take these on a daily basis, within 12 months their erections will return.
The data is not supporting that at all. Taking daily Cialis has not shown to improve and enhance recovery of sexual function.
Okay, so this then brings me to my next question, which is a really important question for a lot of men who are struggling financially to stay on top of medication and penile rehabilitation treatment. Now, I don't know what it's like in the US, but a quick review of some pharmacy websites over here in Australia show that 5 milligrams of Cialis, 28 tablets of 5 milligrams Cialis, costs approximately $160 Australian, or in 100 at the time of this recording, it's about $150 US. So my question to you is, does it make more sense both therapeutically and financially for them to use daily vibratory stimulation therapy instead of the PDE5s? Does it make more sense both therapeutically and financially for them to use daily vibratory stimulation therapy instead of daily PDE5s? And instead just to use the PDE5s, the maximum strength PDE5s, solely for penetrative sexual purposes?
It makes sense to me, but we're waiting for the randomized clinical trials from several centers in the United States to show how vibratory stimulation uh, helps with recovery of nerve function. But preliminary data shows that men who use vibratory stimulation on a daily basis or at least 4 times a week have a 6 months to 9 months earlier recovery of sexual function and spontaneous erections. If a person has a limited budget and they want to use the cheapest method, obviously the cheapest method is a vibrator, obviously, because doesn't involve medication, doesn't involve prescription. It's something you just plug in and you use. So I recommend to your audience, get a vibrator and begin using it every day religiously. It's not going to hurt anything. It's only going to help with their recovery. As far as taking the pills, in my practice, I again recommend taking the Viagra, 100 milligrams or 20 milligrams of Cialis. If
Which
they
are the
want
full
to take
strength
it,
ones. Those are the
full
full
strength,
strength. Yep.
take it half an hour before vibratory stimulation. Why? Because if you take it without any stimulation, you're basically wasting your money. I guarantee you, you might as well throw it in the trash. You need to stimulate. So what I tell my patients is take the Viagra or Cialis and stimulate like crazy 20, 30 minutes afterwards using a vibrator, or masturbate or whatever you have to do. The goal is to stimulate to increase nitric oxide for the Viagra to keep in the first place. So in my practice, I tell them to take about 4 Viagras a month or 4 Cialises a month if they can't afford them more frequent.
In the case of the vibrator that you're talking about, let's talk about that. In the case of the vibrator that you're talking about, let's talk about that. That's the Viborect, which for you're the inventor of the Viborect. It's something it's really it's getting a lot of profile now. Uh, in terms of using vibratory stimulation with a Viborect, what you're saying, if I understand you correctly, is you use the Viborect on a daily basis, but let's say once a week you use the Vibrect together with a high-strength PD5. Do I get that correctly?
That is correct.
And
That is
ideally,
correct.
within a sexual environment, preferably with a partner.
Yes. The Vibrect is specifically designed to stimulate both sides of the penis at the same time. A regular vibrator only stimulates one side of the penis, and in order for you to have adequate sexual reflexes to be activated, you need to stimulate both sides. You can't really get a good erection if you masturbate with a flat hand, or imagine having sex with only half of the vagina. You need to stimulate both sides of the penis. There are two different nerves, and I developed the Vibrect based on studies that showed that using two vibrators on the penis increases sexual response by at least 50 to 60% in studies that were done independently in Miami project. Therefore, I recommend using Vibrect because it's a easy device to use. It's approved. It's the only device in the world approved by medical regulatory agencies such as the United States FDA, CE, Australia, many other countries, Health Canada, to stimulate the penis for erection. It has shown safety. It has shown lack of irritation. You know, you don't know what the vibrator that you buy for $10 from a pharmacy is going to, potentially injure the penis, because it's not designed for the penile tissues. So
So in
that's
this
why the
case, from what I
Vibrate.
understand, in the United States, to offer a device like this, given how especially litigious Americans are, you had to jump through some major hoops, didn't you?
Absolutely, the Vibrate is the most regulated vibrator in the planet. It has gone through multiple testings, electronic safety, EN 60601, multiple very, very strict testing to show that it does not hurt the penis, it does not cause skin damage, it does not cause nerve damage, it does not cause any type of damage, and it's been in the market for more than 2.5 years, and we have never had any complaints to any of the regulatory agencies. Why is Vibrect specifically designed? Because it's a double head vibrator, and it uses a high frequency and amplitude that is not reproducible by regular, over-the-counter vibrators.
So what you were saying before as well is that it's not that the Vibrect has actually been designed. You've got two models of it. It extends beyond just what we've been talking principally about in terms of penile rehabilitation following prostatectomy. You've mentioned that it's used for psychological issues like post-traumatic stress disorder and other factors, but you also mentioned the spinal cord injury. Can you just talk a little bit about some of the other applications of the Vibrect?
I can only talk about applications that have been given to us by the FDA because of our limitation of claims. The Vibrect, this is the exact wording. The Vibrect is a handheld medical device for home use and clinic use to provoke penile erection in men who experience erectile dysfunction and to provoke ejaculation in men with spinal cord injury. Now, the cause of erectile dysfunction can be variable. It could be psychogenic or anxiety related, depression related. It could be men who have had the diabetes or other complications from medical disease. It could be men who have had surgery or radiation. So the causes of ED is not limited.
You mentioned some complications that can lead to erectile dysfunction. I want to ask you about a patient, we'll call him Max. Max is not his real name, obviously, for confidentiality reasons. But Max is a patient with a history of high blood pressure and heart disease. He's also undergone a radical prostatectomy. So what advantages does vibratory stimulation have for patients like Max over alternate treatments like injection therapy and the use of PDE5s like Cialis or Viagra?
The first thing I would evaluate how severe his erectile dysfunction is by having him fill, standardized questionnaires. I will ask him, how good is your erection with several treatments that he's using. I mean, is he using a highest dose of Viagra? Does he get a good erection? Does he respond at all? Is he injecting?
I
How
suppose my
severe is it?
question, really was more in the area of with some of these medical treatments, if they have high blood pressure or heart disease or diabetes, is it correct that in some of these cases they actually can't take PDE5s?
Oh, if there's a contraindication, yes, vibratory stimulation has no contraindication. The only contraindication for use of Vibrect is whether you have a little soreness on the penis or some kind of an ulcer or some skin lesion, so you don't irritate it more. Men with cardiovascular disease or taking medications that are causing that would make use of Viagra, Cialis, and Levitra contraindication are not contraindications for Vibrect.
So in other words, if they can't use PDE5s or injection treatments to aid with penile rehabilitation because of their heart disease or diabetes or any of these other conditions that prevent them from having the high strength PDE5s, for example, Vibrect is a good choice for them.
It is a good choice, but Patrick, one thing that I always tell my patients is the following. Erection is a spectrum of disease. It can range from mild to moderate to severe. Men with mild to moderate disease that have potential still a chance for a spontaneous recovery and adequate sexual function should use vibratory stimulation religiously. Men who have profound medical disease, profound cardiovascular disease, men who have severe erectile dysfunction, they haven't had an erection in 10 years, or if they've had prostatectomy, that the nerves were completely removed and they were put on hormone therapy and basically radiation. We need to be honest with them and tell them, you have developed, basically everything has been done to injure your erectile function, whether it's your own medical disease or the treatments to treat your prostate cancer. In that case, I would recommend not wasting their time. And not with vibratory stimulation. They can still use it for orgasms and everything else. But I would tell them to seriously define how important sex is for them. And if it is important and injections are not working and they're not happy with the injections or there is contraindications, go for the penile implant. We don't want a guy to sit around and waste time at the age of 70 until 75 and basically not have any sexual activity for 5 years and then decide to have a penile implant when he's already too sick to use it. I would say get one as soon as you realize that things are not working and move on to the next step.
I understand that the US government, namely the Department of Veteran Affairs, has recently put its support behind Vibrect. Can you tell me a little bit about that?
Yes, the Vibrect is now approved and is covered for all U.S. veterans and active military personnel for treatment of erectile dysfunction, and also the Vibrect X3 version is approved for treatment of ejaculatory dysfunction. Remember, Patrick, there are hundreds of thousands of U.S. veterans who are young and they're coming out of Iraq and Afghanistan and service to our country, and they have developed erectile dysfunction, either psychogenic or depression-related, anxiety-related, and these patients usually do not successfully respond to Viagra, Cialis, and Levitra, and they are very frustrated. So the studies that have been done have been reviewed by the Veterans Administration and also their own experience with the Vibrect, as well as the use of the Vibrect in infertility clinics for men who have developed a spinal cord injury as a result of their service. The Vibrect is now approved for as a option for men with erectile dysfunction.
So they're using them for IVF and things like that. Is that what you're saying?
They're also using it for IVF, for obtaining sperm for in vitro fertilization. Yes.
Right. Dr. Tajkarimi, I really appreciate you taking the time and the candor and the extensive detail that you've been able to educate us with this evening. Very, very valuable information, and I think what you've done is you've helped educate the listeners to this program, but you've also helped really, you've been very honest in your approach, and I think we're very, very grateful for that.
Thank you, Patrick, and I like to thank you and what you do, and I have great respect for sexual therapists who spend thousands of hours encouraging post-prostatectomy patients to be optimistic and coach them in their long path to recovery. Many patients have benefited from your work, and people like you. One thing that I like to stress is sexual therapists should be a very important part of your, your armament for penile rehab. Studies after studies have shown that a surgeon who coaches their post-prostatectomy patient along their recovery, their results are better. And that's why I sit down with my patients, just like you, Patrick, and I tell them, listen, be optimistic. Don't give up. Your urinary control is going to come back, and everything we're going to do is going to improve your sexual function. Be optimistic. Don't give up. Don't get depressed, because if you get depressed, everything is going to fall apart. Remember, Patrick, anxiety, impatience, and depression. These are the three enemies of erection. And if you get into a cycle of depression and anxiety after surgery, your nerves will not wake up, because you will basically be in a constant state of sympathetic adrenaline rush that kills erections. What I tell my patients is relax. Don't focus on erection. When you're making love to your wife, don't think about erection, because the minute you think about erection, you will not get an erection. You need to focus on the pleasure of sex, on the touch, on the experience of sexual encounter, and erections come themselves. Don't focus on erection. Many men, thousands of men, have performance anxiety, even post-prostatectomy. This is a concept that I'm sure you're well aware, that many men after prostatectomy have such low self-esteem that they are so frustrated during a sexual encounter that they basically kill any possibility of getting an erection.
Just through performance anxiety.
Performance anxiety is a killer of many successful nerve-sparing surgeries, because their wives is like saying, come on, sweetheart, you can do it. Come on, sweetheart, you can do it. And that's not going to help. I encourage the wife to stop setting a timeline for their erection to come back. Just pleasure each other, and erection will come back.
Once again, I just want to thank you for joining us today. It's been a terrific conversation we've had, and I feel deeply honored and privileged that you gave us all of this time. Thank you very much.
You're welcome. Thank you so much.